So today we will discuss about the lateral wall of the nose. The objectives are to learn about lateral wall of the nose, its features, the conchae and meatus, blood supply, nerve supply, lymphatic drainage, the development and the clinical anatomy. The lateral wall of the nose is irregular because of the presence of conchae. The conchae increases the surface area of the nose for effective air conditioning of the inspired air. It separates the orbit above, maxillary sinus below, and lacrimal sacs and nasolacrimal duct in front, and it is having the following parts: the vestibule, the atrium of the middle meatus, the conchae in the posterior aspect, and the meatuses. So here we can see the meatuses that is present below the conchae, that is inferior meatus, the middle meatus, the superior meatus and the sphenoethmoidal recess. So again the lateral wall is made up of both bones and the cartilages. The bony components includes the nasal bone, the frontal process of maxilla, the lacrimal bone, the ethmoid bone with superior nasal concha and the middle nasal concha, the inferior nasal concha made up of the spongy bone only, the perpendicular plate of palatine bone together with its orbital and sphenoidal processes, and the medial pterygoid plate. The cartilaginous part is formed by the superior nasal cartilage, the inferior nasal cartilage and 3 or 4 small cartilages called the alar cartilage. So the cuticular lower part is formed by fibro-fatty tissue which is covered with the skin. So coming to the conchae. So the nasal conchae or the curved bony projections directed downwards and medially. So there are 3 conchaes. The inferior nasal concha is an independent bone. The middle concha is a projection from the medial surface of the ethmoidal labyrinth, and the superior nasal concha is also projection from the medial surface of the ethmoidal labyrinth. This is the smallest concha situated just above the posterior part of the middle concha. Then the meatuses. These are the passages beneath the overhanging concha. So if we just lift the conchae, then underneath the space is present, that is the meatus. So each meatus communicates freely with the nasal cavity proper. So the inferior nasal, the meatus, it lies underneath the inferior concha. It is the largest of the 3 meatuses. Then the middle meatus, so it is present beneath the middle concha. It presents the ethmoidal bulla, which is a rounded elevation produced by underlying middle ethmoidal sinuses. And the hiatus semilunaris, it is a deep semicircular sulcus below the ethmoidal bulla. So here we can see the depression just below the ethmoidal bulla, that is the hiatus semilunaris, and the infundibulum, it is a short passage at the anterior end of the hiatus. Then the superior meatus, so it is present just below the superior concha. This is the shortest and the shallowest of the 3 meatuses. And just above that the above the superior concha there is a triangular depression. So, that is called the sphenoethmoidal recess. So, usually the structures will be opening into this meatuses. So, we will see one by one. The nasolacrimal duct is opening into the inferior meatus. So, the nasolacrimal duct that will be opening in this, and it is guarded by the lacrimal fold or Asner's valve. The maxillary sinus opens into the hiatus semilunaris, and the frontal air sinus is seen in the anterior part of the hiatus semilunaris. The opening of the anterior ethmoidal sinus is present behind the opening of the frontal air sinus. So, in the middle meatus, we are seeing the maxillary sinus in the posterior aspect of the hiatus semilunaris, and the frontal air sinus and the anterior ethmoidal sinus in the anterior aspect of the hiatus semilunaris. And the middle ethmoidal sinus opens into the ethmoidal bulla, and the posterior ethmoidal sinus opens in the superior ethmoidal or the superior meatus, which is present beneath the superior concha. And in the sphenoethmoidal recess, which is a triangular fossa just above the superior concha, receives the opening of the sphenoidal air sinus. So, when we observe, the ethmoidal sinus are anterior, middle and the posterior. The anterior ethmoidal sinus opens in the anterior aspect of the hiatus semilunaris. The middle ethmoidal sinus opens into the ethmoidal bulla, and the posterior ethmoidal sinus opens in the superior meatus. Okay. So, the nasolacrimal duct opens in the inferior meatus, the maxillary sinus, frontal sinus, anterior ethmoidal and the middle ethmoidal in the middle meatus, the posterior ethmoidal in the superior meatus, and the sphenoidal sinus in the sphenoethmoidal recess. The blood supply, again here it is divided into 4 quadrants: the anterosuperior, anteroinferior and posterior-superior and posterior-inferior. The anterior-superior quadrant is supplied by the anterior ethmoidal artery and the posterior ethmoidal artery. The posterior-superior quadrant is supplied by the branches from the sphenopalatine artery. The posterior-inferior quadrant is supplied by branches from the greater palatine artery that pierces the perpendicular plate of palatine bone and passes up through the incisive fossa. In the antero-inferior quadrant is supplied by branches from the facial artery. The venous drainage, the veins form the plexus which drains anteriorly into the facial vein and posteriorly into the pharyngeal plexus of veins, and from the middle part to the pterygoid plexus of veins. The nerve supply, the general sensory nerves are derived from the branches from trigeminal nerve and distributed to whole of the lateral wall. This here also it is divided into 4 quadrants. The anterior-superior quadrant is supplied by anterior ethmoidal nerve, which is the branch of ophthalmic nerve. The anterior-inferior quadrant is supplied by anterior superior alveolar nerve, the branch of infraorbital, which is the continuation of maxillary nerve. The posterior superior quadrant is supplied by lateral posterior superior nasal branches from the pterygopalatine ganglion, and the posterior inferior quadrant supplied by posterior inferior lateral nasal nerves. The special sensory nerves or olfactory nerves are distributed to the upper part of the lateral wall just below the cribriform plate of ethmoid up to the superior concha. The lymphatic drainage. The lymphatics from the anterior half of the lateral wall passes to the submandibular lymph nodes and from the posterior half to the retropharyngeal nodes and the deep cervical nodes. The development of the nose, earlier we have seen it starts from the 4th week of gestational age and develops from the frontonasal process which grows between the primitive forebrain and the stomatium. Then frontonasal process gets divided into median nasal process and the 2 lateral nasal processes. So, in between these two there is a nasal pit and they forms the nasal sac, then future it gives rise to the nasal cavity. So, during this time the superior, middle and the inferior nasal conchae develops as a curved elevations from the lateral wall of the nasal cavity. The ectoderm lining the roof of the nasal cavity becomes specialized to form olfactory epithelium which provides the origin of olfactory nerve. The clinical anatomy. The hypertrophy of the nasal mucosa over the inferior nasal concha is a common feature of allergic rhinitis, which is characterized by sneezing, nasal blockage and excessive watery discharge from the nose. The questions for assignment. Describe lateral wall of nasal cavity, its features, blood supply and innervation, middle meatus of nose, the structure opening in the middle meatus. Thank you.